Because we're live! Hey, America! We're here. We made it. Hey, Lisa, introduce our guest who you found a troll in the streets with you, and like I feel like it's gonna be great.
Martin Cech,
Troll in the streets.
long time collaborator of Mischief on the Health Tech Nerds, and now actually part of the Health Tech Nerds team, and doing all kinds of industry analysis about the ridiculous health tech ecosystem, and also things like earnings from healthcare companies. Kind of following that, there's a lot of dirty stuff there.
Yeah.
So.
I'm calling in from the Health Tech Nerds Mid-Atlantic headquarters in Washington, D.C.
Amazing.
Very nice. Fantastic. Well, I'm up with the Democrats in Boston. So we'll see what happens to me. We'll see if like things get. Well, Lisa, we did hear from a loyal fan who called one of our other loyal fans, who then told on that loyal fan that they apparently we have many fans in California, and most of them are not insulted by what I call California, which is the People's Republic of California.
Yeah. So we're cool. We're cool.
I feel like it's fine. I think
if that's an economy you admire, well, they're doing pretty well. So, whatever. Can we just say shout out to Mayor Mamdani, who, as we all know, has balanced the budget in New York City just by taxing a few people who should have been taxed.
No, and you know what? The governor for more money. That's what he did. He did.
Listen, the budget is balanced, Kat. It's done. You can't hate on it.
He hired reg citizens to like shovel in the winter and paid them like more money than they've probably ever been paid. And I have to say, it was the easiest winter to walk around in the city with the most.
And it was amazing. Getting things done for real New Yorkers. Not like Melissa.
I'm here for that. I will say though that like he just begged the governor for more of the share, which none of I'm gonna give a compliment.
Skill.
That is an important skill. I feel like how it's been presented by him and his team are like, the budget, like doing amazing. No, he just begged. However, if all it took was the New York City mayor begging the governor, why didn't anyone do that before?
Well, I think Eric Adams was being spoken to by like Ratatouille, so that's probably why he didn't beg. Like, just to be clear, he was in Turkey, so he didn't have time to call the governor of.
Look, you had unlimited flights on Turkish Air. Have you been to the Turkish Airlines lounge at Dulles?
I have not.
It's pretty nice. The food is.
No one has bribed us yet, Martin. Like we say on every show, we can be bought.
Yeah. I know. Very sad.
No one takes us up on it. Lisa, I feel like we should keep Martin on for the news show because I feel like it'll be hilarious.
Yeah, I agree. Okay.
I made the news show on my flight about an hour ago, so TBD on what it actually says, but we do have some ideas. Melissa, anything to say before we send you away?
No, got nothing. Give me money.
She's just
give me money.
Sure
Give me money.
Give me money. Melissa some money. Oh my God. Okay, because otherwise, Martin, you can sign up. You can like go in the background if you want, but I feel like you'll be great at this. So So internet fans, this image is supposed to be making fun of the fact that one of our Wi-Fi, mostly mine, always goes out. It's a little too professional, so you can't tell, but it's supposed to be funny. Okay, What happened this week? Okay, let's start. You know how like on Friday, everybody was like, Marty McCary's out. And then on Saturday, they were like, no, fake news. And then he was back in and then he was out and then he was back. He's out. Officially. He's done.
All the reporting was like, Marty McCary has 9 lives. And
in here, it says he's a cat. So who knows?
But he's out. And having the same name as him, it's a little disconcerting.
Oh, well.
Like, am I also about to get fired? I don't know.
I mean, I don't think you can get fired. I feel like, it's just it's whatever it is. Marty McCary. I don't know, man. This was just like, I think we were all expecting to see like which other, agency leaders or cabinet leaders are going to be exited. I think this one was predicted. We got a pretty limited amount of time here until the midterm elections really hit, and the clock is ticking.
Yeah, I don't know. Like I always say, I don't really pay a lot of attention to the FDA, so I kind of was like on this. I will say I like that he was no on vapes, but then kind of went yes, maybe because he was trying to do like his 7th life as a cat. I also like that he did not take mifepristone off the shelves. That was cool. But apparently he really screwed up a lot of other stuff. But again, I don't hang
rare
a lot
drug
with these
people
people.
did not like him.
Yeah, rare drug people were pissed. Or who's the is it Matthew Herber who just like, I mean, his op-ed was like, fuck this guy.
Yeah.
So
Wow.
yeah, I don't spend a lot of time at the FDA, but yeah. So, but yeah, here's some things also that happened. Apparently, RFK advisor or spokesman was like, "What the hell? We were supposed to make America healthy again, and we approved a bunch of vapes that taste like cake." I think go this guy. Hopefully.
There's a lot of like shady stuff being sold in gas stations. And I feel like there is a big like gas station enforcement like loophole here in America. Like you can buy whatever you want there. You can buy gas station opium, you can buy flavored vapes that are not regulated by the FDA because they're like on the black market. Like there's just a lot you can buy there. I feel like is not really great.
I think you can do a lot, and also my local gas station has a lot of gambling in it, and apparently there's some weird loophole that allows them to have gambling.
Gas station gambling.
Also,
perfect.
They sell children's toys right in the front.
She's in Georgia.
I'm in Atlanta. Well, typically in Atlanta, it's not even a gas station. It's just called the Corner Grocery, and it also has an Indian food establishment attached to it in the back. So
I love
I don't know, but I will say I do like it. It does seem like there are illegal things in there, but like who knows? Okay, other exciting things. Lisa, Anthropic. We love Anthropic, right? Because they said "F you" to surveilling Americans.
Well, maybe.
We believe that they did.
Sure. I mean, for me, I gave the side edge to this one because first of all, if you don't remember, and Martin, maybe you remember this, the Gates Foundation is planning on closing down, right? Like the whole thing is like they were like, we're gonna stop existing and like, oh well, in terms of like funding like global public health and whatever. And this is kind of part of the like the end of the like what was it like there's like the movement to their billionaires were gonna like give away all their money and then they like stopped talking about that and they were like, JK, I'm not giving away all my money. And so this is kind of part of that like philanthropy is no longer cool for the richest people in the world. And part of that is that, like, first of all, there was a divorce here for the Gates family and Gates French family now. And then, like, I think Bill Gates and the Gates Foundation announced that they were like going to be shutting down. Mark Zuckerberg also, like, in Priscilla Chan, they also shut down a bunch of philanthropic activities. But specifically, like, they formed this partnership to work on public health stuff, but Gates Foundation is like is going to shut down. Like it just seems like a weird thing to partner on. That is my opinion. So I don't know, Martin, if you have any thoughts on this, but I was like, oh, side eye.
Yeah, I feel like just give the money to Melinda.
Yeah. Like give it to Melinda, and then if you need to give away more money, give it to Mackenzie. Like I feel like she's great at that stuff.
Or the Health Tech Talk Show. I don't know if you
or
guys
the Health Tech Talk Show. We just to be clear, Anthropic, you can sponsor us. You can own the entire talk show for a cool $1 billion. No problem.
Yeah, we're also. I uploaded the wrong deck, so we're going back to. Yeah, it's just in the right order. It was on an airplane, so whatever.
Okay.
I mean, you should give it to us. Okay, yeah. So vapes, whatever. Also, abortion pill is still on the market. The Supreme Court said yes. They said, "Oh, the FDA has some authority." What? I think your Wi-Fi, not mine.
No, it's your Wi-Fi. All the rest of us are all fine. It's once again you. Once again.
I'm like not even in the state I'm usually in.
That's
so
true.
I don't
That's true.
But anyway, this was
you.
Great. The Supreme Court said, we can still mail these pills. We'll see what
happens.
Great. Also fraud. More fraud. Lisa, what's happening with fraud?
Yeah, I mean, it's hard to say, but there's been like the whole team has been on this tour of the country. Now, I believe they're going to withhold $1.3 billion from California. Martin's nodding, so I probably got that right. It's good to have someone who's smarter than me and actually read stuff. That's helpful too. So it's like a Russian nesting doll here. You're the most knowledgeable, Martin. And so I think it's $1.3 billion. Unclear. There were lots of articles and news about what's it called? Nursing homes? No, it's not nursing homes. Yes, nursing homes.
Yep. They're in here somewhere. Yep. Hold on. I've got good stuff. Oh, wait, this guy. Hold on. We're going back.
Oh, that guy's here. Cool. Hospice, hospice, not nursing homes. There's a lot of sort of expose around hospice providers, including a extremely suspicious number of hospice providers that are doing 30%. Things that are considered, in LA. It's like, that doesn't make a lot of sense. So there was some like information about that. And so unfortunately, that does seem like there's probably some fraudulent activity happening there. I don't love the holding. I don't love the withholding. Exactly. Don't love the withholding of Medicaid dollars, but I do appreciate that is a pretty large number of potentially fraudulent hospice providers. So.
Yeah.
It's kind of weird trade-off. Like, I was talking to someone who runs a business in hospice, and they said, like, originally hospice was designed, and there's all these mom and pop hospice providers, they're, quote, like, doing God's work. And so Medicare was like, yeah, we got to make it really easy and really fast for people to get on hospice, and just kind of never updated anything. And that's the trade-off. If it's really easy and really fast and there's nominally a lot of money, people are going to abuse the system, which sad.
It's sad.
It doesn't really make sense. Like I think it's one of those things where, as far as I can tell, like, not enough people are getting hospice care who actually need it. And yet there's like this weird, potentially fraudulent activity happening. Palliative care, hospice care are like underutilized, but then also maybe there's a bunch of fraudulent activity there. I don't really know, but that feels
I don't know.
To me.
Like this guy.
I really liked him. He's just making stuff up.
So, I will say about the fraud stuff, like, if it's that bad, that's pretty freaking crazy, right? If 30% of hospices are like in LA County does have 10 million people, but like, I do know one of the data sets that HHS was using, they weren't looking at it correctly or something like that.
Oh, this is the New York data set, right? Where the New York
data set
summed instead of averaged the monthly.
Yes.
The monthly fields, which is a little embarrassing. So they were like, 90% of New York Medicaid participants are getting home health services, and it was actually just like a normal amount because they
it was like month to month or whatever. So not great. So when
you get excited about something and you're like think you're onto something, and then you like send it to everyone before you actually double check your numbers. I feel like that's what happened here.
Yeah. You know what I feel like that's like, Lisa? I feel like I get really excited when I miscalculate how much my stock options are worth. Right.
You're like, whoa, and then I'm a millionaire. No, you're not.
I think it's like 32 million and it's actually $32. Like that's kind of how that was. But which happens to me all the time. So, but now I just ask Claude how much my stuff is worth. So that's great. But yeah, this guy, so this specific company, was like writing scripts or whatever, fake scripts, fake doctor stuff, $1 billion Medicare fraud. That seems like something that someone should have caught early. I don't know how early they caught it, but I will say this picture was included in this article. This is the
strongly appreciate that this is the CEO. Great news.
So good. I wonder where they got this. Do you think it was like on his Instagram?
Totally on his Instagram. 100% on his Instagram.
I think it's generous to say Instagram and not Facebook Classic.
Facebook. Regular Facebook. Sorry.
OMG. Anyway, apparently fraud is off the chain. JD Vance, he's talking about the fraud everywhere. I think they're trying to set him up for a win, but I think the bummer is like for him that only Dr. Oz looks like he's winning with the fraud.
Yeah.
Dr. Oz and Kim Brandt, they are like crushing the fraud. It's those two. And JD Vance is like coming in to do some speeches. So I don't know. I think everybody likes Marco Rubio better because he also took over Spirit Airlines.
He's the CEO of Spirit.
Famously popular airline and airline, Spirit.
Yeah, I think a lot of people had a lot of feelings about Spirit. I have feelings about Spirit, but not the ones that I think the people who love it have. But anyway, let's see what's happening there. Okay, work requirements. States are still confused. Update.
Yeah.
Oof.
Yeah.
This is not
States
great.
Are confused. States are confused. I think.
Do you remember in college when you had an assignment and it was due, and then you were like, "Well, I'll like get to it tomorrow," and then you like maybe like you didn't get to it tomorrow for whatever reason, probably a good one, and then you asked the professor for an extension, and the professor was like, "Okay, fine, just this once," and then you felt way worse in that period where that's what's going on here. So the rule about implementing this is sitting at what is it? CBO.
CBO. No,
right?
It's
OMB, you guys. OMB. Office of Management and Budget.
It's just sitting at OMB, and they're like, I think, scribbling stuff on paper, and I'm like, oh god damn it, is what I anticipate. I don't know. I don't have any firsthand knowledge, but man, it is like they're really cutting it close.
Well, and the bummer too about this is like Oz has already said the states will not receive an extension, and they have to be implemented like by January of 2027, which is
famous last words.
Yeah,
famous last words.
This does bum me out. Like I know a lot of states are doing stuff, and maybe they're going to have to extend it because I mean this is like pretty ridiculous at this point, and this is like actually a big change for a lot of systems. I think like all I've seen that has happened that's been useful, that's sort of useful, is all of the big prime vendors in the states said that they would give the states in total like $600 million in discounts.
But discounts from what though? Like if you like that I mean, that's great. Like that was a nice one that they put out and they were like, oh, we're not going to profit from this, but it's like discounts from what? I just, the reality is it's very hard to move this many systems at the same time. Everybody has different timelines. Everybody has different tech debt. There's a whole whatever. And so the challenge of this being a federal state program is like, can't be overstated, right? It's just, it's a lot. It's a lot.
It is a lot. It is a lot. It's like not ideal.
Nebraska took the very low-tech solution of just allowing everyone to self-attest. So Nebraska implemented it May 1st.
I did see that.
And they were just like,
good for them.
Let's all have a good time.
Let us go.
Good for them, dude. Good for them, because this should not be adding this massive amount of burden. There's just not enough time and it's too expensive. Unfortunately, if you do the math, like you're going to expend more money, like doing all this stuff across, whatever, 64 systems or whatever. So no.
Yeah. Georgia, looking at you.
Georgia.
Well, we'll figure it out.
Well, so. You've not been figuring it out.
You didn't figure it out yet when you previously tried.
But we have we know it doesn't work.
Which is everything.
And that's more than a lot of other states, just in case you were curious. Also, I'm in Massachusetts right now. I'm sure they'll figure it out and then we'll steal other ideas. Okay. Okay. Oh, I wanted to actually talk about this. Okay, so this is how a health bill is getting sued by 100 companies. Well, maybe not 100, maybe just a few. And this is the WAPO article, and it's covering the Ricky Lott lawsuit. Who's the dude who like got one of the notices, and he was like W2F. And I don't know this guy, I haven't looked into him, but like I guess he doesn't have a lot going on, and so he is suing Health Gorilla et al. For stealing his medical records. And I actually read this article because I was like, which is this a new one? Like, what is this? And it's covering the same stuff with QHINs or any on-ramp vendor, right? Getting their stuff off of the national networks. And what I actually want to talk about is this amazing quote from Bob Watson. So I think I have two separate quotes here. He's saying, apparently to the world, that there is no way he can possibly surveil all of the records being pulled through Health Gorilla from whatever national network. And as you guys know, I did work at a company that bought and sold data. And I assure you, first, we would not even let them on. Right? Like we would have lined up the DURSA and said like, oh no, we don't let lawyers, that is not TPO or public health. Because we did have more than the national networks. We had broader data use than the national networks, but like we would have said no. We didn't even take those calls because we would Google them. And you actually can see who's pulling what and where it's going. So I asked my best friend and your best friend, Brendan Keeler, probably Martin's best friend, Brendan Keeler too. And I was like, I suffer from overconfidence, and I read this and I was like, Bob Watson, formerly of Javari, was a guy we all kind of respected. Like, am I wrong? Which is something, as you know, Lisa, I don't often think. Brendan was like, he's wrong. This is like, maybe not wrong, but like, he's like, credit card companies are a great example. It's like 700 bazillion transactions a day. And like, they actually can like check them in real time. And he's like, not true. And I was like, yeah, I mean, here was my experience working at a real company that did stuff like this. And he was like, yeah. So he's saying here, there is no way for me to surveil 50 million plus transactions a year in the network. Can't be done. Okay. And then it would be difficult to detect lies in the network.
I don't think that's true either.
I'm detecting a lie right now.
Can we just... So that's the thing.
Kat, you're freezing again.
From extreme over... No, I'm saying the same thing. I'm just saying I suffer from overconfidence, which you guys are aware of. But like seeing this in the Washington Post, seeing Bob Watson, who we used to call Javari Bob, lie to the Washington Post. Like
I don't understand once again why you would say that to a reporter. That's what confuses me. I feel again like everyone who's the CEO at these companies, not all companies, by the way, could really use a little refresher on how to communicate with the press.
Don't answer the phone.
Don't answer the phone.
Did a lawyer approve this message? Like,
I can't imagine.
You do not comment, and no comment is a comment. So just don't comment if you're in a pickle like this.
Why check your voicemail? Why are you answering voicemail like unknown numbers and don't check?
That's the thing. Like when the Washington Post comes across someone's phone, are you really like, oh, hey guys?
The guys who did Nixon in? Oh no, thank you.
Yeah. So this is very confusing to me. And again, because Bob Watson is like a credible dude. So I'm just generally confused. Like
very confusing.
When he came into Health Gorilla, because they like scout their leadership, right? Like when he came in Health Gorilla, I was like, oh, like maybe this will be a legit company now. Like, okay, but like what? Yeah. So like I'm not full of shit. Like do you guys like agree with me that this is like not real?
Again, I think Martin and I both agree that you should never answer your phone. Right? That's our summary.
To call or email me.
Don't ever answer the phone. It's not worth it. No, hard no.
Oh my God.
I bet though that the lawyers pay a lot of money for transactions, so you got that going for you.
Yeah, maybe that's what it is. I don't know. It's very confusing to me. But again, this is in the Washington Post. I think it was this week, and these are actual quotes. So you can go read this piece too. You can also read about your man Ricky Lott, who is suing everybody. Yeah, that's great.
It's good to have hobbies.
Okay. Okay. So we're getting to like the thing we all really want to talk about, but like before we get to that. Let's talk about alcohol. What do you guys think about alcohol? AUD. What do you think?
It's great.
Reckon America?
I mean, alcohol, not AUD. I enjoy alcohol.
I do enjoy alcohol.
I don't know about you.
I do. I have an open bottle of wine just off camera. It's decanting.
I cannot wait to have.
That sounds great.
Yeah. Oh. Wait. What? You're in East Coast time. Okay. Yeah.
Yeah.
This show used to be at prominent drinking time on Friday, and we had to change it because, like, whatever. But I don't have anything decanting, but I will open something and it'll be great. But yeah, Stat actually has put out a bunch of stuff about alcohol use disorder and how it's actually like destroying America, and none of us pay attention to it. Again, going back to my old life at Collective Medical, we could analyze like ED visits across the country. Like, and I care very much about opioid use disorder and all kinds of different things, but we would actually, it's coded differently, right? So you can see OUD, other types of substance use disorder down here for overdose. And then like AUD was always way up here on all of the ED, all the ED streams. So like, it's crazy to me that like, yeah, I always wondered like, why do we not care about alcohol use disorder? Because apparently it is kind of crushing us as a country. Thoughts, feelings?
I totally think that this is a serious issue. And I do think it's really, really easy to drink way too much, and that a lot of people are drinking like really dramatically high amounts of alcohol. And yet this is in the public health, trap, right? Like this is just like America like does not want to address pervasive public health problems, does not want to address, prevention and preventive care, which includes cutting back on things like drinking alcohol. Remember, we also still have, even though it's quite small as a percentage of Americans, cigarette smoking, tobacco smoking, and increasingly cannabis smoking of other things is also a huge problem still and causes extremely preventable deaths and like disease states. So, it's still those things, right? Substance use disorder is substance use disorder, including alcohol. That's how I look at it.
I say just like really jack up taxes on alcohol because
sin taxes
all the way. I think like one of the things with alcohol is like you don't necessarily want people to stop drinking. You just want them to drink less. And there's really good evidence that if you just like even minor increases in taxes on this stuff, like people just drink a little bit less on the margins. And so my answer, like it is for everything, is go the Singaporean model and throw a 20% VAT on all that stuff.
Yeah, syntax. But there's also a lot of, I think like our friend Joanne is saying here, is, like it's there's huge business interests in here. Like there really are. And also one of your other favorite topics, Kat, is like GLP-1s, right? A lot of people on GLP-1s want to drink less. And that's also, in addition to eating less, they also want to drink less. And
they're
so,
I also get booty in my personal experience. But whatever. Yeah, I think that and even like with the whole food pyramid nutrition guidelines and all that, the HHS chose not to like just totally say don't drink at all, right? And Oz said it's cool, just don't drink it in the morning. So
which I don't agree with, right? If you're going to drink, don't you want the whole day to like metabolize that alcohol and then like have a good night's sleep? I think you should drink in the morning if you're going to drink. Just saying.
I am not.
I think I'm a lunchtime drinker personally.
None of this is medical advice, just to be clear. Once again,
we are
please
not
don't take our advice. This is our perspective. Martin's going to drink at noon. I'm going to drink in the morning. We'll see.
I do not day drink. I cannot operate well as a day drinker. So
not like, I did live in France for 3 years and like with lunch you gotta, but no, not like on the weekdays. Like just like if like I'm gonna have a glass of wine, it's usually like brunch. I'm going to Le Diplomat, I'm getting a seafood tower, and I'm having a nice Chablis.
Okay, nice. Work meeting lunch is a day drinking situation. That is for work, and I love work, so I will do what I have to do for that. But yeah. Not to say I don't drink, because when the sun goes down, I do. So anyway, yeah, check it out. This is actually a good piece. It got a lot of play. A lot of other publications took notice. And so at least it's starting a conversation that we as Americans don't like to have. So props to Stat for putting this out. Okay, we already talked about this, whatever. We were out of order. Okay, here's what we really want to talk about. Okay. You guys, as with all of the other crazy shit we comment on typically in America on the internet, we have no idea if any of anyone's allegations are true. What we're going to talk about is the really poor communications decisions that companies in our space often make. Lisa, would you like to give us an overview before we jump in?
Oh boy. So whatever day this was, 2 days ago, 3 days ago, Munjal Shah is the CEO and co-founder of Hippocratic AI, a company I've been critical of in the past, has posted this addressing misinformation post from their website and talked about it and called out someone else we know, Sergey Polevkov, who is a blogger and a writer and works in the health tech arena as well. And Sergey's been writing on his Substack, about healthcare AI companies and sort of concerns about how they operate, concerns around funding and valuations and things like that. Sergey writes things in I think a pretty dramatic tone of voice, and he puts a lot of things behind paywalls and stuff like that. It's how he's getting subscription for this. But I think he's been writing about Hippocratic quite a bit, and it's been quite some time. Apparently, the rumor mill tells us that, customers and prospects were asking Hippocratic and their funders about these questions. And so for whatever reason, Hippocratic and Munjal and his team decided they needed to respond to this. So what did they do? They posted an entire website that had a line by line, true false, sort of refuting different points that Sergey had made. They also, as you can see here, tagged Sergey in their post. My goodness, if you are a regular watcher, listener of the Health Tech Talk Show, you will have heard us say to not encourage the Streisand effect, which is what? It's when you bring more attention to something bad by talking about it in public a lot. And this is like a textbook case, in my opinion, with limited knowledge of the Streisand effect, where you have literally tagged and brought people to Sergey's profile and his information to read more about what he is saying about you. And this one really threw me back for being like textbook Streisand effect. Like, what are y'all doing? You may have a private message you want to share with your customers and prospects, but like this, in my opinion, is not the way. Then, of course, there was a lot of chatter about it, and Sergey in particular posted a video where he was talking about it and, refuting some of the things and expressing his concern. And I think, feeling quite attacked. Let's just keep in mind the power differential. Like independent blogger and like huge venture-backed company, those are like two different things. Is Sergey a journalist? No. Is he protected by the First Amendment? TBD. It was a very power differential thing, and obviously very disturbing. And he was saying that he was like being attacked in different ways, and people were reaching out to like people he knows. And so it was getting kind of icky pretty fast. And again, like textbook, like should go into like PR people should study this for the Streisand effect, in my opinion. That's my summary.
Yeah. I think that was great. Again, I don't know, like I just told you guys, I don't know how to calculate the value of my own freaking stock options. I don't know a lot about AI. I certainly don't know things about AI doctors or whatever these guys do these days. But I am really fucking good at PR. So, and this isn't even an opinion. Crisis, again, as I will say, as we always critique companies that do weird things in communications, crisis comms is the most studied, the most process-oriented field in communications, right? 100%. So you do not do this. You do not do this. If some little random blogger, and sorry, Sergey, you are a little random blogger, start saying crazy shit. Lisa, people say crazy shit about us all the time on the internet. What do you not do? Start trolling their comments and draw attention to them. That because you have a big following and they don't, right? Like when we wrote that chief patient officer thing, like a lot of people were like, "Fuck yeah, girls," and a lot of people were like, "These dumb girls," right? Like you just don't add fuel to the fires you don't want to be hot, right? Like when an airline crashes, you do not communicate, right? You go, right? Like these are studied behavioral science things. This is not our opinion. This is like peer-reviewed shit. You do not do this. Yeah. And so like, I don't care if they're attacking Sergey. I don't care if they hired some mean PR firm that like is back alley, no fingerprints. That's stupid. Like you shouldn't do that. But like, because if you're a real company, you don't do those things. Like legit. Also, I was searching because, we have all these screenshots because we keep all of our news all week. And then we compile this deck 20 minutes before we actually have to go on air. So weird. It's all been deleted.
I mean, we knew this would get to this place because it's like, like this thing spirals and goes bad. As the great Michelle Obama says, when they go low, we go high. And I just like it really, if that's all that you need to remember as like a corporate leader or whatever in like PR stuff, then remember those lines, right? You do not want to get down in the dirt like this. It's never going to be the way to address it. And per Kat's comments, I used to work at another airline, the RIP Virgin America. I was part of the team on the marketing team that was responsible for the crisis comms if and when something bad happened. It didn't happen, thank goodness. But like there is like you just said, there's a whole process for taking things down very quickly and being and not having anything there, and then having only very, very controlled, accurate, totally responsive communication in a particular way, right? That is not what this is. This was a blasted out to the internet, like LinkedIn post from the CEO, link into the guy, like
it's gone from the CEO's LinkedIn as well. It's also gone, if they had it on their company page, it's gone. Yeah. So, but screenshots live forever because Lisa Berry's in our world. So yeah, I would just say like, okay, clearly someone gave you the right advice, which is to please
get rid of this,
right? Which the damage is already kind of done, but like you can limit the effect. So like whoever advised you, Hippocratic AI, to take your shit down, you should keep them. Whoever advised you to go for it and lose your mind on the internet, you should fire them if you haven't already. they're bad at their jobs.
Just gonna speculate that the person who did that was the CEO of Hippocratic AI, who like was his staff was like, please continue sitting on your hands and don't say anything. This is a Substacker, and we have raised more money than the entire GDP of some small countries.
Yes.
And look, we've all been there. But
my
favorite part of this was the oh, did you know that Sergey is a convicted
felon?
Yes, convicted securities fraudster or insider trader. And then dot. By the way, judges have dismissed all allegations against me. I want to address the misinformation. I don't know. I just feel
honestly, that was the perfect, that was a sign that you're going wrong, right? First of all, as far as I know, Sergey has never hidden, nor could he hide, because it is, public information, Department of Justice, all these things, right? This is something in his past. It doesn't mean that it's not wrong, but he is literally this is very clear. It's not secret information, and it's not directly relevant to this beyond sort of what he did in the past. And then to refute that and to call that out, it was at the top of the page, y'all. It was he is a felon, number one. And then at the bottom of the page, it was
so is our president.
Yes. Well, it is such an ad hominem attack. It's again, not secret. And then at the bottom of the page is all charges have been dropped against Munjal Shah's previous company. I was bro, when did you read that and say this is a good idea? This is not a good idea. Don't say that. It's not looking good.
Yeah. The other thing I'll say is a lot of people who get busted for insider trading, they made maybe a couple $100,000, or sometimes they even lose money because if you have inside information, you don't always know when the market's going to. And Sergey made $8.5 million. So finger in the wind. He gets markets, or was really lucky.
He gets markets.
Yeah.
No comment.
Again, I don't know. I do not know Hippocratic AI. I think Munjal Shah came to one of the ragers I threw in DC, and he never came up and thanked me for inviting him. So
okay, so now you're
thank
boo.
You.
Okay, but this was also it was a big party. It was a rager. So whatever. I'm just saying I don't know this guy. Again, I don't know anything about their money or anything like that. But I will say, if someone who is convicted for insider trading and made $8 million off of it said that my company was shady, I'd be well, he knows a thing or two.
It does take one.
Once again, no comment. This is no comment.
But I'm saying no one would think any of this if you didn't post all this on the internet. We would not be talking about this today if you did not post it on the internet. So
yeah. That's right. Anyway, the point was really how they handled this situation, and I think, Martin, you're probably right. This looks like a CEO special. And I get it, right? It's hard for founders and CEOs to separate themselves from, to do the right thing in this situation because they feel personally insulted.
Just like that Starbucks CEO and the unions, even though I was totally on his side.
Don't respond.
Okay. I think we got one more here. Okay. Oh, yes. I wanted to just tie some things together because Hippocratic AI is also a GC company, right? Yes, they are. Yeah. Pretty tied to the administration. They seem to be everywhere. And as you can see here, HackCode got a little visit from our great secretary, RFK. And they do get a lot of companies featured. So I do wonder if there was some additional scrutiny, or people were oh, we read this blog from this guy, Sergey. It says you guys are shady. Is that true? I just wonder if all the increase.
I just don't know who could read Sergey's blog again. No offense, Sergey, and be this is super because he writes in a very dramatic style.
It's a telenovela.
It sounds like it'd be a good excuse to not work with someone versus saying, you would rightfully say, hey, what's the deal with this dude who's after you? Oh, well, privately, he said these things. They're not true for these reasons. We don't know why he has a vendetta against us, but whatever. It's a private conversation. It's hard to imagine somebody would on the surface believe be oh, I better not work with them. It's well, you might want to ask a question or two, but that's it. It's private.
Yeah. Well, I will say there was also that Forbes piece on Munjal Shah, right?
Forbes piece. Forbes is not exactly the most.
There was a. I don't remember who it was, but there was actually, even before Sergey, a big expose. I don't know. They're all
as you can see in his own refuting of Sergey's points. Like, he's been involved in some stuff.
Yeah. So I don't know. And it was more about it was about that everything that happened with his old company, but whatever. Anyway,
yeah. Well,
the point is, like, all this was timed interestingly, I thought, but maybe not. Who knows?
Kat, did you pay our media liability insurance premium? Just say yes, because
yeah,
we might need it.
Lisa, it is auto pay every month. Also, we're not even media. We are not a real TV show. We are
good.
Not also doctors.
Allegedly. Okay. Everything here is allegedly.
Thank God the new show is done.
All right. Allegedly.
Hold on. What's even happening? I don't even know how to get rid of this because my screen's all little and weird.
Done. I did it for you.
There. Oh, thank you very much. Okay, like, special guest who's been here the whole time. Tell us about yourself.
I mean, that was quite the lead-in. I don't even know where to go with it. Like, it's been a crazy week, and an exciting week. One of the things I wanted to chat with you two about. Did you see the news on Photon Health?
Yes,
and we love Photon.
Big Photon fan. So Photon and Doximity teaming up to bring e-prescribing to the people, and by people I just mean licensed clinical doctors, not just anyone who wants it.
Yeah, that's important. That's important.
Like their April Fool's joke, which was e-prescribing for peptides, as we remember. So,
oh my God. Yeah.
I mean, I got my Wolverine stack, and I'm not actually a peptide kind of guy.
Amazing.
I don't like to consume things I get on WhatsApp. I don't
like at the gas station.
Well, that's a different story. My wife is from the sort of greater Philadelphia area, and I am a Wawa fan, and I would say I consume a lot of Wawa, but that feels like a separate category to me from the gas station. I was going to ask you about, so this Photon Doximity thing is interesting to me. I was thinking about it a little bit earlier today. Brendan, of course, already is posted on it on HTN, but yeah, I think it's like I used to work for another e-prescribing network.
Which one?
Yeah, sure. I don't know, they're like a
small one.
That was
a little e-prescribing network with a dream.
Understood.
And yeah, I know.
So say why this is why is this meaningful for Photon?
Yeah, why is this exciting?
Why does it matter? Why does it matter?
Well, so the e-prescribing world has always been like, you're in your EHR and you're connecting to SureScripts, and like SureScripts did this cool thing, which is they sort of went out and built connections with all of the pharmacies, but like historically SureScripts was owned by the pharmacists and the PBMs. It's still minor ownership now; it's mostly owned by private equity, but like that comes with limitations. Like the pharmacies and the PBMs have things that they want, and those things might be different than what a patient wants. And so the cool thing that Photon's doing is building something that's a lot more sort of patient friendly, allows you to do some shopping, allows you to sort of send your prescription where you want to go and sort of have it sent somewhere and then chase after it around the city. And yeah, I think it's like it's a cool moment because Photon's an interesting model, and Doximity is doing this thing where it's like we're sort of leaving the paradigm of like, oh, e-prescribing and doctors are living in their EHRs, and instead, like I was talking to a doctor earlier today, and he was like, yeah, like I would say most of my 80% of my visits are asynchronous text messaging at this point. And you're like, okay, like you don't even need to be in your EHR, you're just like in Doximity, you're sending the prescriptions. I think it's cool. So that is cool. Top of mind for me today.
I have a question, a devil's advocate question. Why can't SureScripts or anybody else just do the same thing that Photon is doing? Where's the moat?
Well, the thing with SureScripts, like I said, is like they're the biggest constraint. I'm not speaking sort of, I worked there like 6 years ago, and I don't.
Who knows what's happening now?
Who knows what's happening? I'm not violating any sort of non-disclosure agreements or anything like that. The thing about SureScripts is it's still owned by a network business, and so they have to keep the pharmacies and the PBMs happy. And one of the things that I think does not make pharmacists and PBMs happy is like people going and shopping and having cash prices available and stuff like that. And so I don't know that like it is SureScripts can never copy it. It is just like the gravitational pull of doing things the way that they've always done it. This is how Australia does e-prescribing, is like you get a text message basically, and then you can send it to the pharmacy that you want. Also Estonia. But we have this other model that like only like it exists because this is a product of the pharmacies and the PBMs. And
seems like Photon is like a bet on, you know, that consumer-ish demand and potentially like provider-ish demand becoming more important over time than the PBM or pharmacy requirements, right?
Yeah, and it feels like I think that, you know, it feels like there's some decent evidence for that. Like cash prices are now, I think,
more available.
GLP-1 showed that there is like a sort of interest and willingness to pay, and also a desire to shop for things. And so I don't know. I thought it was like an interesting announcement today and a cool move for Doximity. I am curious how Open Evidence is going to respond, because it has been very feature tit for tat between the two.
Interesting. I have a question for you. I know a lot of the stuff that you cover on HTN is, you know, goes in cycles, of course, but you and Kevin cover earnings a lot across, you know, as they come out as, you know, important signals of what the hell is going on in this overall sort of healthcare system-ish that we have. Like, can you share with us the current vibe in the markets?
Yeah.
Like, what is, like, everything is so horrible and so bad, but people are somehow still making money hand over fist is kind of my sense.
Vibes in the market are good.
They always are losing money, but making money at the same time, and mostly emphasis on the making money.
You're saying HIMSS?
No.
No.
Everything.
Everybody, yeah. No, the vibes in the market are good. So insurance companies had a good first quarter. Whether that was due to winter storms and a lower acuity than expected flu season is still kind of TBD, but like they had a good first quarter. And so, and they have not had a good quarter in like 2 or 3 years. And so the insurance, like managed care stocks, are doing pretty good. The other sort of sector that we sort of love to listen into is the primary care platforms. So Agilon, Astrana, Privia. Agilon has been on a bit of a journey recently, but their stock's up like 100% in the last month, because
speaking of insider trading, like we are doing a poor job, clearly. God damn it.
100%.
I know. But yeah, Agilon's just been crushing it. Like they're doing a good job of managing their risk-bearing contracts. Stuff like feels like it's going better for those primary care platforms. I'm not even going to say it's a weak spot, but there's 5 publicly traded hospital operators. 3 of them are like incredibly good businesses that you would want to own, and 2 of them are like they have a tougher time. All of them had it's sort of like if the insurance companies are having a good time, then the hospital operators are not. And so the hospital operators are like, well, people were less sick and we were closed for winter storms, and so we didn't make as much money as we thought we would. But in general, like they're all kind of humming along. And so in the insurance and services side, like yeah, everyone's doing pretty well. And interesting. So to the news overview that you did, Aveanna is a hospice and home care company. They reported earnings yesterday, and one of the things they shared, which I thought was fascinating, is they do private duty nursing, and they're like, the labor market is so tight that whenever we get a rate increase from Medicaid, 100% of that passes through to our labor. Like the spread between what we, you know, like what we get as a rate and what we sort of get to keep for overhead and all of that stuff is like the exact same year over year, even though the rates have gone up, because 100% of that is flowing to labor. Wow. The other thing that's interesting is, they were like, well, it's not great that there's this moratorium on hospice and home care because that's going to make it harder for us to acquire. But we do think it benefits scaled incumbents like us because there can't be any new entrants into the market for 6 months.
That's actually pretty crazy. Like, no new entrants. I guess if you're already here, you're good to go.
Yeah.
And someone in HTN pointed out that like there is this weird seasoning rule where if there's a change in ownership for a hospice, within 36 months, you have to re-enroll. So if your hospice is above 36 months, like if you've been enrolled for more than 36 months, the value of that hospice just like doubled, because anything that's sub 36 months is like you can't buy it. It's like it's frozen where it is today, but anything that's appropriately seasoned is pretty juicy.
Appropriately seasoned. Yeah. Hey, Martin. Okay. So I want to hear about like what crazy shit that we all should be thinking about that we're not thinking about. Like, when well, in Georgia, it was post-pandemic, but I think everywhere else it was still pandemic. Everybody, like, there were some flags, people saying like, hey, inflation's actually really bad. And the Biden administration was like, no, it's not. No, everything's fine. People are like, no. And they're like, it's fine. No.
It's
like,
gonna
is
be
there
fine.
Anything like that? Like, are there any signals where people are like, and people are like, nah, but you're like, no, actually those signals are real? Is there anything we should be paying attention to?
Yeah. The biggest thing that I worry about is Molina and Centene are like the two big Medicaid managed care operators. And Molina in particular keeps on being like, look, guys, everything's going to be fine once medical trend and rates come back into alignment. And, so if you're a Medicaid managed care business, you need rate increases if medical trend is going up. And right now, medical trend has gone up more than rates. And so you're like losing some money, probably 2 to 3% is like what the actuaries say these plans are in the hole. Well, the rate increases require the states to like kick in more money, and state budgets are in a bad place right now.
Mm-hmm.
They are not having a good time. I am most familiar with the Colorado state budget because I used to live there and worked for a state senator and then state Medicaid agency. But like they are doing stuff, their state legislature is doing stuff that you would only do if you were like real desperate for money. They are like canceling residency slots for doctors because they can't chip in their share and stuff like that. And so whenever I hear someone being like, oh, well, like rates and trend have to come back into line, I'm like, yeah, but like that could be a while. The big headwinds for states are, the One Big Beautiful Bill Act is changing Medicaid formulations and basically the amount of money that they're going to be able to draw down is going down. There's also just like people don't like paying taxes. And so it's really hard for states to raise taxes.
Kat does not like paying taxes. I love it. Love it. Love taxes.
I'm a big
Me and Jensen Wang.
Yeah, I'm a big tax guy. But yeah, so people don't like paying taxes. And so you kind of like the state budget stuff's bad and things could get kind of dicey in Medicaid for the next couple of years is, I would say, the biggest thing that I'm paying attention to. The other thing that is pretty top of mind is what is going on with like this weird, like there's been like this push, be like, we should all have HSAs and we should all, and like I said, like I am a fan of the sort of Singaporean healthcare model. They have this kind of, but like one difference between Americans and Singaporeans is that a Singaporean would never spend their HSA on like Function Health or something like it. And so I think that like, and like, I think I probably would if I had an HSA, which I do not. So yeah, I think like, well, I have a pretty nice insurance plan that doesn't allow me to have an HSA plan, but I don't want to brag, but it's a PPO. And so, yeah, so that's
our loyal fans who have never worked at a real employer who would give you real insurance. That's like basically a Cadillac plan these days. What?
That's not true. You can also have a super high deductible with a PPO. Ask me how I know. You just don't have a super high deductible, buddy, or their actuarial math that says that you do or do not get access to an HSA. It's all
I love an HSA.
games. It's all games.
Scams. So yeah, those are the two things.
Sorry.
That,
Yes.
like,
Thank you.
Is there going to be like, if we do this push into HSA accounts, FSA accounts, Trump accounts, whatever we want, Trump health accounts, whatever we want to call them, are we all going to spend money on dumb stuff? And like, I love my beautiful dumb country, but like, we like spending money on dumb stuff. So that's the other thing I'm paying attention to, is like,
that's why I don't want to pay taxes.
Yeah.
If you love your beautiful dumb country, you'll pay taxes to support things that we actually need, Kat.
Yes. But not like,
but they
137 biomarkers.
Yeah. Function health is not going to make the cut, because anybody who has to actually run like a national health insurance program or delivery program understands that not everything makes the cut, and it has to have a really high bar of like evidence and quality for the cost. Like, it has to meet a certain standard, and you can't, like, those kind of things are cash pay. They just are. I'd rather we had like our 10 like fundamental like services that are necessary and like really high efficacy covered for everybody, and then bullshit like function health, you can pay cash for it if you want to. Sorry, I mean, allegedly. Sorry. Allegedly.
Yeah. Allegedly.
You know, allegedly.
Yeah, totally.
Yeah, it's fine.
Yeah.
But you know, also the other thing, but there's also like this major, you know, like long tail here of like things that are, you know, we're learning more about every day, like gene editing and stuff like that. But like we can't pay for that for everyone, sadly.
Yeah. I mean, my experience with the French healthcare system was like, if I didn't have a kick-ass PPO, it would be awesome. But because I am an American used to having a kick-ass PPO, this sucks. And I would like to be treated like a customer instead of a huge pain in the ass to every doctor who is out on vacation for 3 months every summer.
Oh, amazing.
Right. God bless America. Okay. Well, what are you most excited about? What do you think is going to be great?
What do I think is going to be great? I don't have I wouldn't say I'm feeling super optimistic about anything in healthcare at the moment.
What about fighting fraud?
Fighting fraud is good. As you can see, I'm a former Minnesota resident, and so hoping they kind of figure that stuff out eventually.
Yeah.
No, I think that there's some interesting stuff in the works at some state legislatures. A DP, like direct primary care program for Medicaid, I think is like a potentially interesting stuff, but mostly just like lining up, and it's like bad news all around. So
I'm just trying to read this weird comment that just came in. I think that might be someone's AI.
Yeah.
Okay, so DPC for Medicaid is cool. We're into
and I'm excited to see on the access program if like anyone can pull that off. Like, I think that I think CMMI I think is a cool thing and should take more big swings. And I thought access is like, am I skeptical it's going to work? Well, sure, but if it did work, would that be really cool and 100% great use of our money? Yes, and so I'm happy that we're spending some taxpayer dollars on it.
Yeah. I hope it works out and someone actually can make some margin off of those rates. Like, that would be, as Lisa always says, that would be the deflationary promise of AI in healthcare. So we'll see if that happens. Okay, last question for you, Martin. Other than Lisa, who obviously is the best poster on HTN, who is your favorite HTN poster?
I mean, Brendan is a classic. He had a good post today on Wiser, which is another program that I really like, because skin substitute fraud, not great.
We hate fraud over here.
But apparently it's subject to the Congressional Review Act, and you're like, well, you can't have nice things if they're politically unpopular. And so I would recommend checking out Brendan's post on Wiser. And then, even if he wasn't my boss, Kevin O'Leary's Sunday newsletter, great read.
Agree.
Yeah.
Agree. I have a ton of people every week who say, oh, have you read in Kevin's newsletter? So I guess it's working, whatever he's doing. Oh yeah, cool. Okay, last. Do you have any last words you want to say to our loyal fans before you can go drink the decanted wine?
No. Thanks so much for your time, and thanks for having me on. And
yay, Martin! Enjoy your wine. Thanks, everybody. See you later.
Thanks, y'all.
Till next time. Bye.